Special Olympics Wisconsin provides year-round sports training and athletic competition in 18 Olympic-type sports for nearly 10,000 children age 8 and up with cognitive disabilities. More than 75 competitions are held each year statewide. The lives of hundreds of thousands of athletes have been changed around the world, and this positive change has now become even more apparent since a health program has emerged, delivering healthcare services to people with cognitive disabilities. This population has a 40% greater risk for health issues. And even more alarming, most healthcare professionals are not trained or experienced with caring for those with disabilities. But Special Olympics took action and unveiled the Healthy Athletes Program.
Well, one of the things that we found in the health profession is that we don't know very much about people with intellectual disabilities. Most physicians, if they're lucky, might see a few, maybe 10, 20 people with intellectual disabilities in their practice for their whole lifetime. Special Olympics has 3 million athletes with intellectual disabilities, so that gives us an incredible ability to learn about the health needs of our athletes. And so what we're trying to do is to gather all this health information about our athletes so that we can pile it all together and start to look at it and see what kinds of health needs our athletes have and what kinds of things that we can do to help make their lives better.
The reason we do Healthy Athletes is because we want our athletes to compete at the highest level that they can while they're training and while they're in competition. With an athlete that comes out and they haven't gone through our screenings, they may not know that they have an eyesight issue, and so they can see better if they get their eyes tested. We find out that a lot of times athletes aren't hearing good enough, so they're not hearing directions of their coach. They may be nonverbal and have a toothache, having behaviors, and the coach doesn't know why. Well, now they know why, because they have a dental issue. So it's just basically to bring up the level of the athlete's health so they can compete at a higher level too.
The Healthy Athletes Program improves, through better health and fitness, each athlete's ability to train and compete in Special Olympics. Statistics show that there are no programs similar to the Healthy Athletes Program, which serves individuals with cognitive disabilities who often do not receive the healthcare attention they need. Athletes can visit one or all of the disciplines offered at the state games, including Special Smiles, Opening Eyes, Healthy Hearing, Fun Fitness, Health Promotions, and Fit Feet. Since 2005, Special Olympics Wisconsin has conducted more than 9,000 screenings to athletes free of charge. Health screenings that can run hundreds of dollars for someone paying full price for an actual office visit. In 2009 alone, nearly 400 healthcare professionals and students entering the medical field volunteered their time to make these screenings happen. The program is also made possible by national partnerships, which provides funds for the Opening Eyes program. Without hundreds of professional volunteers, these screenings could not take place.
They also, I think, are really grasping the value of volunteerism, and they're learning a lot just by looking in the different ears of the different athletes. And because of some of the health history of the athletes, we get to see a lot of interesting ears and interesting results, so it's a good learning experience for them.
It's not just about sports anymore, as athletes can walk away from a state competition with a new pair of glasses, sunglasses or sport goggles, information on nutrition and fitness, or even a fluoride varnish on their teeth. In addition, they receive healthy snacks, toothbrushes and paste, floss, mouth guards, water bottles, and even sunscreen products.
Usually we see around between 260 and 300 athletes for each event. So in a year we're seeing between 500 and 600 athletes, and typically we do anywhere between 150 pairs of glasses, and I think the highest we've done is 230 pairs of glasses.
Even more important is the referral system, as the professional volunteers take time to discuss results with the athletes, then take into consideration more serious conditions they may come across. The athlete is given documentation of their screening results to assist with any follow-up care they may need back in their hometown.
A lot of the ones that we see, it's not so much decay, it's more of the issue of the gum tissue, the periodontal disease. So if we can get them in routine care, and keep them healthy, it would be a lot easier. We have a list of dentists that have said they would take our athletes. And we review that every year to make sure that they still want to stay on that list.
We as healthcare providers, our interest is in providing healthcare to whoever needs it, and this sometimes also provides access to healthcare. We do referrals to physical therapy. If there's something that we find with an athlete that we feel they could benefit from therapy, we write a referral for them, give it to them. They can then give that to their healthcare provider, and they can give it to their doctor, and the doctor can help them find a physical therapist, for example, in their geographical area that could continue to work on maybe some problems that were found as a result of the screening.
The newest addition to the Healthy Athletes program is MedFest, an innovative event offering required standard sports physical examinations to current and prospective Special Olympics athletes. Nearly 100 athletes took advantage of MedFest with hopes to update their medical records or receive their needed physical to join Special Olympics for the first time.
We're really excited to be participating in our first MedFest event for Special Olympics Special Smiles. We have been doing Special Smiles in Wisconsin for about 10 years. We've been fortunate to have this event occur in Oshkosh, Eau Claire, and Stevens Point. We originated in Stevens Point, and one of the things that's really good for us is the fact that we're able to expose some of our private practice practitioners, dental hygienists, and dentists to have a lot of fun at an event where they get to learn something new and participate with the families and the athletes on things that they can learn about their oral health.
Last year at the indoor sports tournament, we went through the Healthy Athlete booths, and Darte went to the Vision one, and it turned out that they discovered that she had fairly serious eye disease, which needed to have attention, or it would have affected her for her whole life. So we were really lucky to find that out, and we were able to get her to an eye specialist who's following her and is going to try some experimental treatment for it.
Not only is Special Olympics Wisconsin changing lives, but the Healthy Athletes program is expanding the capabilities our athletes are already working so hard to prove. Join us in our effort.
People should come and volunteer for the program to help out athletes like Ruben, because Ruben's an awesome guy.